So I'm back with Ryan, and we're going to do a little intro video here to injury prevention, just so that we can better understand what causes it, what we can do about it, just in kind of a general sense before we get to the specific exercises. So I've got basically three main topics here that we're going to talk about. Obviously my memory is not great because I have a clipboard here. So Ryan, first question, what are some common causes to injury? What typically causes injury in recreational athletes like tennis players?
That's the fun part about working with new people, is trying to figure out what led to their injury, because there's so many different factors. It's almost, you're performing a full assessment of looking at the big picture to find out what led to that injury, and there's so many different aspects of dynamical factors that can lead to predisposition of injury. One common area that can lead to injuries being present is either an improper or an inadequate warm-up. If someone is not warming up their body and preparing it for the rigors of tennis and for their match, they may be going into it with a higher risk of injury because their muscles are not fully activated and fully warmed up to be expected to do the demands of the sport. Okay. The old school train of thought used to be lots of static stretching before you play.
Right.
The research has shown over the past decade plus that that's really something that can actually decrease your risk of decrease your performance and increase your risk of injury by telling your muscles to chill out. Or on the opposite end, you want to do things that are going to fire up your muscles and make sure that those are your muscles that are involved in that skill are fired up and ready to go. So making sure that there's the right progression of that warm-up, as well as the right type of warm-up. In addition to that, the training strategy that someone takes, either ramping up their training too fast without a proper progression of week to week, or overtraining, not giving their body adequate recovery time, so they have overtraining syndrome where you develop tendinitis issues a lot of times. That's a big aspect of injury, is when you train too hard or too long, too high of a volume, and you don't give your body the recovery it needs. And that's where you should really seek out either an exercise professional or work closely with the tennis pro to make sure you're monitoring how quick you progress that stuff. Other areas that can lead to injury, if you're using improper equipment, whether it be the wrong fitting racket, maybe the handle is wrapped too thick or too thin with tape, can lead to stress injuries of the elbow. Improper footwear, if you don't have the right footwear for your foot type, and that can lead to biomechanical issues. In addition to that, you have nutritional aspects and hydration aspects of injury prevention. Make sure that your body has the proper fuel, and that's something that Dr. Kripsak talks about in his video. That's so important to prepare your body for it to be working optimally. Outside of those, there's some other specific areas too that, as medical professionals and exercise professionals, we can really work to address with the clients, and that's the biomechanical aspect of it and strength deficits and impairments.
Okay.
When it comes to biomechanics, there are ideal movement patterns in the body that have been shown to be the right movement patterns, so that the muscles are working the best way possible, so that the joints are moving the best way possible. And a lot of times people have poor biomechanics, whether it be their running technique, their jumping and landing technique, how they decelerate and stop to change direction, their overhead mechanics with serving, or just with forehands and backhands, with throwing athletes or throwing mechanics. So, having the wrong or altered biomechanics, whether it's something that they've just never been taught the right way, or their body doesn't have the strength to do what is the right way to do it, that's something that can definitely lead to a higher risk of injury. And the last area that also involves a lot of assessment to find this is asymmetrical muscle strength, range of motion, flexibility, dynamic stability, all of those components of athleticism. If they're asymmetrical or impaired less than they should be for the demands of that sport, that can really lead to overuse problems, that can lead to compensation, as we talked about before. And if something is not doing its job, if one muscle's not pulling its weight, another muscle has to work harder, which could lead to that muscle breaking down prematurely. And same thing with range of motion. If there is one, especially with shoulder injuries, if they lack the right amount of internal rotation, flexibility, and mobility, but have a ton of external rotation, the body doesn't like that imbalance. The body likes to have the right relationship of internal to external rotation, and that can lead to an alteration in your biomechanics. It can lead to addressing, impacting those other things that we talked about with biomechanics, with overtraining, because the muscles aren't able to handle that type of straining.
So there's like 5, 6, 7, different areas where injury can occur. So how can we possibly keep up with all that, or what's a good general plan, or how should people watching at home then start to address being proactive about those different areas?
And that's the difficult part about it, is because there's so many different things that could play a role in it, that if you're really a high-level tennis player, I mean, recommend it for anybody, but if you definitely, if one of your main goals and passions is to become a better tennis player, you should really seek out someone who could do this assessment with you to find where those areas are, because it's difficult for everybody to really pick them up on themselves. A lot of times they may not realize they're going on. And it's important that you, when it comes to your warm-up, that you're getting educated by either a tennis pro who is knowledgeable of the right type of warm-up for tennis, or an exercise professional or a certified athletic trainer who can teach the proper progression of warm-up. It's not just going out and jogging 5 laps around the court and you're warmed up. It's maybe starting with some small movement exercises to improve your mobility, and then working with some small movement exercises to get your muscles and your core firing, and then you work into some larger group exercises for like some lunging and single leg RDLs, and then you work into some more dynamic stuff, so there's a progression of exercise in that warm-up that's gradually building the body up and preparing it to play. And those are some things that we'll touch base in our dynamic warm-up video as well. Making sure that you're consulting with a tennis pro about the proper equipment, about the proper biomechanics of your tennis skills. And if it's outside of the swing mechanics and the skill mechanics of the on-court skills, seeing an exercise professional or someone who is well-versed in possibly doing a functional movement screen or a biomechanical assessment to look at outside the shoulder and elbow, what else is going on in the body, biomechanically speaking, that may be altering their ability to reach that next level and setting them up for injury. Same thing with nutrition and hydration. If you have to, speak with someone who's very knowledgeable about that. A lot of great resources on the web. A lot of great resources in the community with nutritionists. Community hospitals have them a lot of times. Going to your local sports performance center and talking with their exercise professionals about their recommendations for nutrition and hydration, and following the recommendations that Dr. Kripsak mentions in his video. Great things to make sure that you're addressing that. And then the final aspect is having to do with the asymmetries and impairments in range of motion, strength, flexibility, dynamic stability. That comes down to having a good fundamental program of conditioning that was set up based on an evaluation that someone performed on you who is knowledgeable of finding those impairments and asymmetries, so that your program is going to really ideally fit what your goals are as an athlete and keep you on the court by addressing the factors that may be predisposing you to the injury.
I want to touch on one thing that you mentioned just a couple minutes ago that I really like. Obviously we're talking about injury prevention and injury treatment, but you mentioned that addressing all of these individual areas can not only help keep us healthier and keep us playing longer, but it can raise our performance level as well.
Definitely.
And that's like just a 1-2 punch. That's huge. Not only be healthier and feel better and stronger, but actually play at a higher level as well. That's awesome.
Definitely. If you're warming up properly, your muscles are going to be properly prepared to accelerate from that first serve, rather than taking a few hits to get warmed up. Your muscles are ready to go. Your body neurologically is ready to fire quickly and explosively with the proper warm-up, so that can improve your performance. If you have ideal biomechanics, your body's going to work more efficiently and your muscles are going to work better to do the skills required in the sport of tennis, that's going to improve your performance. If you take care of all of your strength deficits, that's going to give you a good base to develop general strength training exercises specific to tennis, general speed and agility exercises where you don't have to worry about something breaking down because there's a deficit. That will lead to increased performance. So by addressing all of these areas, it's really going to play a big role in you not just getting by, but reaching that next level with your performance, because you have that foundation to get to that next level.
Awesome. Well, last topic that we have here on the list has to do with, I guess, identifying when enough is enough as far as maybe pain or discomfort is concerned. When do we know that it's time to go seek a professional's help?
It's important that if you're addressing these issues that come up and you do have some aches and pains, that beyond the initial ice and anti-inflammatory over-the-counter medications, rest, activity modification, that you're still having issues, it's important that you definitely seek out the advice of a medical professional. And some key things that you can look for that would make you want to do that a little faster rather than later and letting it linger is definitely if you have swelling in the area.
Okay.
That's a sign that there was tissue damage and that something happened that needs to be assessed. A loss of range of motion, of your normal range of motion. All right, if your elbow normally moves like this, and after a week and a half of having severe elbow pain, you can only go here, there's something causing that lack of motion, and you want to find out the reason. So a loss of range of motion beyond your normal range. Okay. Isolated tenderness in one particular spot. A lot of times if it's general muscle soreness from working out hard, the whole forearm may be sore, or the whole elbow, the whole shoulder. But if you have one specific point that is tender for a week or two that is not improving with the general things you're doing, the conservative stuff, and still when you continue to push on that one spot, you're having sharp pain, that could be a sign of isolated injury as well, so that you would want to seek out further care. Complementing that, if you have some associated strength loss, if for some reason with your condition you've got the pain, but you notice that you're considerably weaker in that body area, in that joint or in that muscle group, most likely it may be due just to the pain, but also it may be because you actually damaged structures in that area, or it may be a neurological issue. You want to make sure that if you have strength loss, you're following up as well. And in general, if you're having pain and symptoms that are not going away within a week or two after you've taken the proper approaches of icing and resting and modifying your activity, and then you go back to your activity and they come right back again, you want to seek out further assistance, because there may be an underlying cause that is not so evident that someone who is skilled in the assessment and evaluation skills can pick up, that you may not realize is going on.
Okay. Well, great stuff. Any final thoughts you want to throw in there having to do in general with injury prevention and treatment for tennis players?
I think the main thing is just to keep your body in tune. Make sure, number one, that you are eating right and staying hydrated so the body has the fuel it needs to train. Make sure that your body is moving appropriately with proper biomechanics so that you're not putting yourself at a higher risk of injury. And making sure that you're strength training and using an adequate warm-up program to deal with any kind of deficits you have going on, and building in corrective exercises for your specific deficits into your warm-up program as part of your normal routine can be really an effective way to not only decrease your risk of injury, but also keep you on the court and improve your performance down the line.
Great. Well, Ryan, thank you very much for the time you're spending with me. I appreciate it a lot. I know everybody watching at home appreciates it as well. Thanks very much for your insights.
All right. Thank you very much for having me.
Yeah, you bet.